Welcome back to Daytime at 9. We are covering a very important and yet tough to talk about topic this morning, addiction. If your loved one was battling or is battling an addiction and you would like to know or kind of find signs of what they are, and you want someone who can help and know how it is to get through the suffering, the men of Soba recovery are here. Greg Hanley, Alex Dragici, and of course Daniel Baldwin. Good morning, fellas. It's been a rough morning, huh?
A little bit.
A little bit?
The weather, the rain. Yeah.
Well, it can't be that tough if you're living the dream. Am I correct?
Love this weather.
All right.
Liquid sunshine.
Well, you know, we talk about it all the time. You talk about it all the time. You try and pick up on signs when it comes to families, you know, of how to help them out and how to, you know, pull the ones out that are showing the stress and what alcohol addiction or drug addiction causes to a family. So, you know, how do you help the people go forward?
Well, you know, it depends what's going on. The best thing is catching it early. Mm-hmm. And I've been talking a lot about how parents are coming in now and they think their kids are drinking or smoking pot too much and finding out that they're on much harder drugs, and they have been for a while. And they're afraid to talk to them. Drug testing is something I advocate for a lot at home, to just find out what's happening so you can deal with it.
Well, what are some of the most common, obvious signs that, you know, you look for?
Well, Greg says something that's been always so poignant to me. Name the number of people that you can say morning, noon, and night for years you watch their behavior. Your family, or maybe your coworkers, but really your family. If something looks funny, if something looks different, or you suspect, promise there's something wrong. I mean, you raise your kids. Suddenly at 17, they're doing these weird things and this stuff. And Greg look at me and go, and I've heard him on the phone. Yeah, something's not right. Go have them tested. You know, so let's start with a baseline of knowing the truth, and then move on from there.
Well, honesty is key, but when you're in that phase, you're not going to get that out of anybody.
No, not at all. So you got to check. And when you have that window, especially when somebody is under 18, you can just sit them down and say, you're going to do this. And these days, the ones that are dependent on their phone ringing of you paying the bill, you can have them do it too. But you've got to answer the question and start the conversation to see what's going on to know how to deal with it.
Well, sometimes it just starts with a letter, and I'd like to start off with the letter right now and read some of it. And this is about Jane, and this is, when we dropped her off at Soba, we weren't leaving Jane behind. It was some other person. Someone else was living in her body. She was not the daughter we raised. That girl was gone and lost. You know, that's just part of it, you know. Let's talk about Jane for a minute, you know, and how you helped her.
Oh, I love Jane. She's awesome. And I've gotten to know her family real good, and she was one of the ones that came in, and she would tell me a story, and I would tell her, you shouldn't even know these things. You know, you should be cheerleading or, you know, going to the prom or dating a boyfriend. And she got caught up in things that people do, and it was by accident. She started using pills, and then it turned into other things at a really young age. And when I met her, there wasn't much left to her spiritually. Yeah. And, you know, when I meet these young people, the saddest part about what this does is it takes their life, like the way their energy or their spirit is gone. Yeah. And they come in and they're just, and so getting off the drugs is easy. Yeah. We can get them off the drugs relatively quick, but it takes time to rebuild that spirit. And Jane actually works. She moved to Texas. I got a phone call maybe a couple of months ago, 3 months ago, and she said, you know what, I think I want to go to Texas, and she actually works here at SOBATexas now.
That's good, and I hear also she's celebrating 3 years in March.
Yeah, yeah.
How cool is that? So you found her so for her.
Yeah, she is amazing. Every time I see her, and many of them, we have an alumni meeting in California that there'll be over 150, 200 of these people showing up that I met at their worst moment of their life. And to see, it makes my heart feel happy when I see them, you know, alive and doing things. And I was telling one of the or the clinical director yesterday, that what I'm seeing now, because of this model of long-term recovery that is actually working, the first year people are getting on their feet. The second year they're kind of setting up their lives for what they want to do. And the third year they're actually doing these things. And I'm starting to see now, after 3 years, people that, young kids that were dying that are doing amazing things.
Well, Sober Recovery is doing amazing things. I'd like to add to that. And, you know, Alex, when you get the people in and they come in, the kids, you know, like you said, they're kids. You know, how do you just build them back up? You know, how do you give them the confidence back real quick?
Well, that's a good question for me, but it starts with them wanting to be there. So there's a lot to that question. I mean, there's the therapy side, there's the social side, all the things that go on in that long term. But one of the biggest things is we don't have, it's not like a jail or a prison, so all the kids and everybody that's there, they want to be there. We're not fighting to keep them there. It's quite the opposite. After the long term, you know, they've been with us a long time. It might be time for them to go get a job, move on, you know, get out of rehab.
So there's always another stop. There's too many steps.
Completely. But that's really the biggest one, is them wanting to do the long term and sticking with it, doing the program, doing what, you know, counselors, therapists are
meant to do.
Yeah.
Well, I can tell you from experience, because at this table, I'm the one person that actually went into this program, and I'll tell you twofold, that first week. Acceptance and presentation. You know, walk into a restaurant, if you will, and when the waitress walks up to them and she goes, "Hi, you guys, how are you?" as opposed to, "Do you know what you want?" You know, I mean, when you're greeted by people at this recovery center and at all of them, with people who really, that work there, want to be there and want to help you. You know what I mean? And you really get that feeling that, okay, the stuff that I've done that got me here, it's okay. We're gonna build from there, as opposed to guilting and shaming.
And it is okay.
And threatening you about you're gonna lose your job. It was never about that for me when I was in.
You know, real quick, I know Soba, they have the whole thing going, and it's not like that. You know, but we'll continue this in a second. We'll be right back. Welcome back to Daytime, and we're talking about the man from Soba Recovery who's giving strength back to all the families that are in need. Greg Hanley, Alex Dragici, Daniel Baldwin. Fellas, right before we went to commercial, we were talking about how they make it seem like it's difficult to go to recovery, and that the people don't want to be there, but they need to be there, and they need to want to do it. You know, how is the convincing turned around?
Well, the first thing is people sometimes they have a real skewed idea of what treatment looks like. So they think it's in a hospital, or, I mean, I've had people call and go, "Do they tie you down during detox?" And, you know, it's not that. It's a loving environment. And so you want to take the fear out of it. People are scared. And that's the underlying part. When I was doing the intake calls, I would have really scared parents on the phone.
What are they afraid of?
They're afraid of everything. They're afraid their kid's going to die, or their husband is going to die, or whoever it is in their family. They're in a chronic state of post-traumatic stress, and they don't know what to do. And so we want to walk them through it, and we want to give them information of how to talk to people and how to open the conversation, and you know, how to get through that fear. And most people, the first starting out is they just need somebody to talk to about this. And they're embarrassed and they're afraid, and you know, we can sit and listen. I would go, "So what's going on?" And then I would listen for 15 minutes. And then the answer would be, "We can help with that." And you could just feel kind of an ease of the pain of that fear go away at that time.
You know, do you ever just say, "You know what, don't take my word for it, just come and take a tour here at Soba"? You know, because I've walked through the facility, and it's nice. Everybody's friendly, everybody's helpful, they care.
Well, and the other thing too is that I like to, if there was kids or people that were afraid of coming to treatment, I would say, look, just bring them in with no obligation, no anything, just to come here and talk. And it's really, really rare that somebody comes in, sits down for a while, because it's like they go, it's this, aha, you know, you know, here's a place that I can talk about what's going on. And when they come in and see what it looks like, they go, yeah, I want to stay. Alex actually,
I mean, it can sound like a sales pitch or whatever. It's quite the opposite. And moms come in, or they're touring, or they bring, their kids with them. And we walk around, show them the property, tell them what it's going to be like. But the second they see other residents there, they instantly, they relate. They're like, oh my God, that's me. And
I mean, I think it's a nonstop thing when it comes to that. They see the people in the meet and greets.
For the person, and I from my experience, for the person that's going in, the actual patient, it would be, if you could imagine, turning yourself into the judge.
Yeah.
You know what I mean? Like you're taking that drive and you're scared. You don't know what's going to happen. You know it's not good. You really don't want to be there because you've done things and you're using drugs or alcohol that has gotten you there. And when you drive up, you're literally going, I'm turning myself in now. What's going to happen? But once you get there and you see the community and the facilities and everything, you start looking around going, hey, this doesn't look like it's going to be so bad. It's not what you imagine it being, a cell and punishment, and it's not that at all.
Well, we have great testimonies, and here's another letter. This is a letter from Barbara. It says, when our daughter was in college, her behavior at the fraternity parties put her at great risk. Her alcohol abuse was just, one of the things that was just gathering. It was gathering, it was stunned, and she frightened them. We had thought that the values that she had taught at home would help her out. But for some social dangers that can be present at the parties, but they felt that they went wrong. In the letter, they said that her addictive behavior was spiraling down. Well, they were at a loss for they didn't know what to do. They needed help, and that's where you came in. They called you out and called you up and said, how do we do it?
Well, yeah, we're bumping. We have whole college programs now, and those days of Animal House and we're drinking beer, now there's so many pills that people can get addicted to and things that students are using that they can get trapped, and it gets really dangerous. If parents knew how many ambulance visits there were to universities, they'd be horrified. And so we made a college program based on this. This is also alum that's probably got over 3 years, and I'm friends with their parents still, I mentioned, would you put a little something out there about your experience, and they get their kids back. So this particular young woman was just caught up in the college experience, and it got out of hand, and she needed a place to settle into the environment, finish school, and she's doing wonderful now.
Well, that's good. And sometimes it's better late than never, as long as you just catch it before it escalates some more. But don't go anywhere and stay with us, because we'll be answering some of your questions that you've asked Sober Recovery, and they're here to answer them. So we'll be revealing some of those a little bit in the show. We'll be right back. Welcome back to Daytime at 9. We're talking with the men of Sober Recovery, Greg Hanley, Alex Dragici, and Daniel Baldwin. Fellas, it's been an interesting conversation so far. The letters of love that you get, it's got to feel pretty good.
Oh, it's awesome. It makes you feel like you're doing something. Well, the part about recovery is that it's not what you can get, it's what you can give. And being able to give this back, people took an interest in me when I was deep in my addiction, and they stood up and they talked to me and they fought to get me somewhere where I could deal with what was going on. And that was 10 years ago. And what I learned in recovery is the way that you get to keep your recovery, and the way you get better is by helping other people get better. So, that's what we do.
Well, you're doing a good job at it. I know the last time y'all were here with Kimberly, y'all wanted to get closer with the viewers. You wanted to have the viewers ask y'all some questions, and so we did, and they spoke. One of the viewer questions was, short of an intervention, how do you get someone help if they refuse help? By the way, not a minor, an adult.
Oh, that's a good one. That's a Greg or Daniel question.
That's a Greg or Daniel
yeah,
question.
That's a really good one.
Well, the first is, what's your main thing?
It starts at the call. It starts at the call, or it starts at the conversation.
There it is. is it starts with a conversation, and it is people are afraid, and their ego is in the way, and they don't want to admit. It's like having a really bad relationship that you're in, and trying to tell the person this person is bad for you. The relationship that a drug addict or a person with alcohol problems has is with the drugs or the alcohol. That's their strongest bond that they have, and you talk about it and continue to talk about it, not in anger, not in a punishing way, but just continually to say, I'm worried about you, and people are worried about you, and they're talking about these things, and I'd like to see if you would just talk to somebody about this. Yeah. And it doesn't have to be me or us, it's just somebody that has been through it. And almost everybody we meet in San Antonio knows somebody that's either in recovery, been in recovery. There's some kind of association to it around here.
It's tough being an adult, especially listening to people.
When your car's making a funny noise, you don't bring it to your lawyer. You bring it to the shop to get your car fixed. Yeah. If there's a problem going on with your family member or your child or whatever it may be, or a friend, call somebody who fixes that. It's absolutely right. Call somebody who knows how to deal, and it does start exactly with that conversation.
And a lot of people, I think that question also is, a lot of people are scared to say something because they're worried of the reaction. I'm scared they might yell at me or explode or storm out, or, you know, it's like, and most of the time it's quite the opposite. Unless you're coming at them, attacking them, then you're going to get that really bad lying, I'm not doing anything kind of reaction. And it's really the conversation, how to approach it is a big, big thing too.
Well, you can't avoid it. It's an emergency. And if somebody is sitting there bleeding to death, you're not going to just go, you know, I hope they just decide not to bleed to death. Yeah. You're going to go, you're bleeding to death. And you need some help, and you need some bandages, and we need to call an ambulance. And this is the same thing. We're just talking right now about the fact that the opiate problem, it is absolutely an epidemic. And starting with the pills in the cabinet, and it's ending up on heroin when people can't afford it or can't get it. And it's not something, the things that young people are doing are not something they can grow out of these days. Where it was, oh, they'll grow out of that. They're not growing out of it. We need to help them get out of it.
And please remember, you brought something up earlier, you know, in this segment about, you know, these nice letters from these family members. Let me tell you something. I know for sure something that fuels the three of us to do this is the fact that, do you know how many people we've buried this year? In the last 12 months? How many people we know that have been in other programs, maybe weren't necessarily with us, but people,
last couple days.
So it's time last couple of days, people die. People die.
Well, or they die waiting to come in. I've seen multiple times where I'm going to come in tomorrow, and tomorrow was too late. And it is, we don't want tomorrow to be too late.
Well, the time is now then to make that call, I would assume. So you can't get a reaction if nobody's on the other end. All right, well, stay with us. We will be right back with more Soba help, recovery, and trust me, this will help all your loved ones. Welcome back to Daytime at 9. For the half hour of Sober Recovery, we have been answering all your questions, and the viewers have asked plenty of them. You know, and a lot of the concern was the cost. Greg, Alex, Daniel, you know, cost is a big issue. And so is location, because they feel sometimes, what if they're too close to home? You know, so how do we go about this?
And it is an important one. Luckily, right now, we accept a lot of insurances. So a good thing to do, it starts with a phone call. We have a lot of specialists that are on hold 24/7, ready to take your call and help, and they will verify your insurance and take a look at what it is, and you can come in and get a full year of treatment for little to possibly no money out of pocket.
And I've seen you go above and beyond to try and get people in, so I know you're good.
And there's really good insurance in Texas.
Really good insurance.
Nice thing about the healthcare changes is that you can actually sign up for insurance and already have problems. So somebody who doesn't have any can go and sign up and get their kids the help that they need, or get themselves or husband or whoever.
And the good part about getting different facilities, a lot of parents worry, and even residents coming in, they worry, you know, I'm still in San Antonio. I don't know if I need to get away. I need to get away. Well, luckily we're not the only facility that Soba has.
We have a few. We have some in California, and now we have Mesa, Arizona. When we were first out here, some people from Texas didn't really want to go to California. Some really want to go to California. It's beautiful there right now. But Soba Mesa outside of Phoenix is kind of another Western vibe type of recovery, and so we can help. If you need to get away from the drug dealer, boyfriend, girlfriend, whatever, let's go.
Well, it all starts with the phone call. So fellas, I want to thank y'all very much. And for more information, you can give them a call at 866-547-6451 or go to SOBATexas.com. You can even find them on Facebook, Twitter, Instagram. They're everywhere. Remember, one call is all you need.
Thanks, bro.
Yeah, thank you.